So good afternoon. Welcome to the ITS Friday seminar. And today we'll continue on our topic of active transportation public health. I think this is the second speaker, and we have another speaker coming up related to that. So today we're very pleased to have Peter Jacobsen, and he's a professional engineer with a strong interest in public the health impact of public transportation, public policy. That's a mouthful. Yeah, so his work ranges from injury prevention to active promotion of active activity, and today he'll talk about one of his influential work called safety in numbers. That shows if you have more people bicycle and walking, you can reduce the risk of incidents or crashes. Yeah. So Peter, it's all yours.
Well, thank you for showing up. I'm glad to see the room's almost full. It's quite reassuring for someone who's speaking to speak to a full room as opposed to an empty room. I was asked to give a little background on myself. I'm a civil engineer, and actually I worked in the water business of all things. And you say, well, water and biking, walking, how does that fit together? It turned out I had an uncle who decades ago, it basically said, oh, everyone needs to have an avocation. So Peter, find something you like to do and then do that so you can sort of find something you're good at, use it your skills, but it's different from your day job. It turns out he taught at a university, and he ended up losing his job, and but he had a little side business already going where he taught seminars. And so he spent his attention there on building that side of his life, and that was very rewarding for him. On my side, I was always like to bicycle and walk, and I went to a town I lived in, had a bike plant company. So they had invited the public to come and listen to this bike plant. And I thought, with a lot of hubris, I thought, I can do a better job than those guys. And so I actually did that. And I ended up doing a bicycle plan for the city of Pasadena. And in there, the Pasadena City Council asked, is Pasadena a dangerous place to bicycle? And so I had to go back and scratch, and look into it. And I did. And Pasadena indeed had a large number of bicycle injuries per capita, but also had a lot of bicycling. And so I then calculated the risk, and no, Pasadena is actually a relatively safe place to bicycle. So that led to safety in numbers. Anyway, so that's kind of how I got to this side. So I'm going to show a little video first, and then the room needs to be quiet because the audio is a little soft. So please bear with us.
This is a test of selective attention. Count how many times the players wearing white pass the basketball. How many passes did you count?
16.
The correct answer is 15 passes. But did you see the gorilla? This video is from research by Daniel Simons and Christopher Chabris and is copyrighted. It is available for use in talks, training, and teaching on DVDs from Bismarck.
So, kind of what I'm talking about is a lot of engineering and whatnot is based on kind of physics and facts and numbers, but there's a human component that I think gets ignored, and that's kind of what that video got at. I imagine if you hadn't seen that video before, the gorilla's not that easy to spot, so it's kind of fun. Humans are really good at seeing what we're looking for. We're very good at focusing. So today I'm going to cover safety numbers. We'll go through that briefly. Then spend some time talking about why it maybe occurs. And then kind of what does this mean? What should we do with this information? As a policy question. Briefly, motorists are less likely to hit someone walking or biking if more people are walking and biking. And that was a shock, and we'll explain why. But it's a factor of 10 in the risk. The safest city in California for bicycling or walking is Davis. And the lowest, the most risky place is Upland, which is a town in the LA basin. It's just east of Claremont, so it's just barely into San Bernardino County. It's right there at the border. So it's a really big factor. But it gets at the sort of this question, like what is safety? You recognize this picture here. Is it the number of injuries, or is it the risk of injury? That's kind of the question. That's what safety numbers really is all about. So the California Office of Traffic Safety will tell you that Davis is the most dangerous place to bicycle. And indeed, the Davis police chief will say that in meetings. Davis is the most dangerous place to bicycle. But I think what's your own gut reaction? Do you feel that bicycling in Davis is a really risky place, or is it a pretty comfortable place? And likewise, walking. Do you feel comfortable walking around downtown Davis? Do you feel like threatened? Kind of what it amounts to is, and the reason I think there's part of this confusion when it comes to cars hitting other cars, it's kind of like more like can you imagine a pool table, and you have all the pool balls laid out on the board, and you roll another pool ball across the table. The number of pool balls you're going to hit is a function of how many balls are out there on the table. So that's kind of what we see in multiple car crashes. There is a little oddity in here. The first two cars in the state of Ohio ran into each other. So what's with that? But okay, but when we look at what's the risk of a motor vehicle hitting a pedestrian bicyclist? The number of injuries increase as more people walk or bicycle. The number of crashes increase, but the risk goes down. So this isn't just pure physics and pure randomness. Why? What could be? There's got to be some mechanism there that we don't understand. So actually, could it be that in a community where more people walk or bicycle, do you think the people that walk a bike behave themselves better? And I don't think that's the case. And I walk across the intersection in downtown Davis. There's lots of people walking. I rarely will break my pace. I'll just keep walking across the intersection because I know the cars will stop for me. In New York City, where there's lots of people walking, people in New York City take pride in the fact they don't obey the rules. Oh, I'm a jaywalker, And then here, this man's talking on the phone while he's walking across the street. He feels comfortable doing that. So I don't think I don't think pedestrians are more deferential or more cautious when they're more numerous. I think it's the opposite. So this actually doesn't explain safety numbers at all. You put me out in, say, pick on Roseville, like I'm going to cross one of those streets. I'm going to be extra cautious. I am going to look both ways. I'm going to be prepared to run, and maybe as I get older, I'm not going to be able to run. So I'm just not going to cross the street, So I don't think it's, I don't think it's the behavior of the bicyclist or the pedestrian. This question all comes up a lot. Is it numbers and safety? Do safer conditions encourage more people to walk and bicycle? And the answer is yes, but it doesn't explain that factor of 10. Maybe more like a factor of 2. You'll encourage more people to encourage more people to walk or bike with better conditions. I live in Southeast Davis, and Mace Boulevard was this big 5-lane road. It goes for a short distance and immediately goes out into the farm field. It maybe serves a couple of hundred houses, maybe 500 houses. There's not much traffic on it. And it was this big 5-lane road, and elementary school is on the opposite side of Mace Boulevard from my neighborhood. And the city, we have gone through and shrunk that road down, put in protected bike lanes on both sides. And I now see kids biking to school at commute time, and that's a change. So yeah, there's numbers in safety, but it's not big enough. You know, that was the whole purpose of showing that video was, you know, like we're really good at focusing. You know, we'll miss things that we're not looking for. So that's in there somewhere, you know. But there's a physiology issue in here too. You know, just, you know, we don't have a perfect camera in our head with perfect processing. You know, we can only see 3 things a second. You know, so there's limits of how much we can perceive and pick up. So has anyone ever been with, or, you know, do you remember your first time driving, or you've been with a new driver? You know, those new drivers are cautious. They're slow, and, you know, as an experienced driver, you're going, oh, step on it, you know. But I think that's what happens is, you know, you just get overwhelmed with information. You just can't bring it all in. You know, think about it. You know, humans, you know, our great-grandparents, you know, never got speeds above 3-mile walking space, running speeds. That's probably about as fast as we ever got. So humans are sort of geared for, you know, speeds of 3 to 5 miles per hour, and all of a sudden you're doing 50 miles per hour. You know, this information is coming way too fast. But, you know, and traffic engineers have done that on the freeways. You know, where we want high speeds. You know, we've simplified the road design. We pull everything back from the edges. You know, the signs are big, and they give you lots of heads up that, oh, Space Boulevard exit coming up. You know, we got lots of, you know, it makes it a very simple driving environment, and which is great for trying to do high speeds, but maybe that thinking isn't all that great for downtown Davis or whatever, where you've got people and general craziness going on. So what's happened is, you know, we create these simplified models. That's how you become a driver. You simplify things. But the downside of simplifying things is you're going to simplify and you're going to eliminate that person crossing this, you know, crazy street, and you're just not going to see that guy. You know, I was very fortunate. I wrote safety numbers, and then one of the first people that wrote a paper sort of, you know, exploring it also, and actually they confirmed safety numbers, was a professor at University of California, Berkeley, David Ragland. He's now an emeritus professor, but turns out he, as a young boy, grew up in Northern California on the Modoc country, and he grew up in the Cold War era, and he's now emeritus professor, and though he's still active. They had a program. The Air Force had a program for young boys. They give them a pair of binoculars, and their job was to go look for incoming Russian aircraft. You know, and you know what a great job for a young boy is to be given a pair of binoculars and defend your country. You know, but you know, I imagine it quickly became boring. But in David's case, it got him interested in this whole idea of signal detection theory. Like, how do humans see things? So, you know, there's a whole literature on this signal detection and perception out there. There's journals devoted to this issue, which is the value of going, you know, cross, what do you call them? Not jurisdictions, cross discipline. Thank you. You know, there's information to be had in other fields that might be pertinent to this field. But you know, obviously, how easy to detect? Well, is it easy to see it? Well, of course, that's easier to detect something that's easier to see. Right? You know, what's your experiences seeing it? There's actually studies that show, you know, in the old, the old radar things you've probably seen, you know, war movies or something like that, where they're looking at a radar screen and they just, you know, it's a fuzzy sort of thing. It turns out if a radar operator has seen an incoming aircraft, the operator is better at seeing the second incoming aircraft. So if your experience helps you develop confidence in being able to detect things. And then consequences of detection is an issue too. Think about it, you're sitting on a battleship in the middle of the Pacific Ocean, and you know, your job is to detect an incoming torpedo bomber that's going to, you know, basically sink your ship. You know, you have a real incentive to spot that incoming aircraft, because otherwise you're going to become shark bait food. You know, so you want to see this. You want to see it. So that, you know, so that's an issue with signal detection. If if you have a good incentive to see it, you know, if it's a threat to you or whatever, you are going to be better at seeing it. You know, you look at this, you know, busy crowded picture on a gray, rainy day. You know, what is easier to see here? You know, the bigger things, the cars are easier to see than the motorcycle riders. You know, the cars are going faster. It's easier to see things that are moving quickly than things that are moving slowly. You know, is it conspicuous? You know, and that's some color, some other issues like that. There's some oddities in there. You know, why are cyclists more likely to detect cyclists? You know, there's some sympathy, empathy issue in there. You know, there's something going on. We're not machines. We're humans.
As drivers or as when they're also cycling?
As drivers, thank you. Yeah, thank you. And by the way, please ask questions. You know, so the question was, you know, are cyclists more likely to see other cyclists? Yes, cyclists as drivers are more likely to see cyclists. Prevalence, we're going to talk more about prevalence because that's of course what safety numbers is all about, right? But you know, there's also a prevalence issue with, are you looking at static images? Think of the radiologist who's looking at x-rays and he's going to see lots of x-rays and he's looking for an anomaly in an x-ray. You know, if you're looking at a static image and you see, oh, this doesn't seem right, you can come back and look at it again, right? You know, let me zoom in on that, you know. But if it's a dynamic situation, things are happening all the time, you don't have the luxury of, you know, stopping and taking another look. You have to make decisions real fast while you're driving. So that's, you know, this whole prevalence is an issue, whether it's static or moving. But you think about pedestrian bicyclists, getting back to safety in numbers, look at it, you know, bicyclists and pedestrians are small, slow, and rare, you know, 3 strikes against you, you know, so I you know, dug into the perception literature, and this is fun. These are researchers. I think they actually paid to have this game written for them, and you can download it. Last time I looked, it was still available. And you know, they just have images go by, and so the TSA agent is looking for what? You know, axes, guns, bombs, you know, heavy sticks, fluids. I mean, it's a tough job, you know, and indeed, you know, it's kind of a little mini scandal, like how often the TSA agents miss things. But that's part of this whole thing. You know, this game showed that rare targets are often missed, you know. In other words, saying humans are really good at seeing common things and not so good at seeing rare things. But they sort of quantified how quickly perception fell off with prevalence. They had a sharp drop off at about 1%. If 1% of the images are what you're looking for, less frequent than that, that becomes hard to pick up. But we had this factor of 10. But that's that factor of 10 we saw in safety in numbers. So that makes me think this prevalence theory kind of largely explains what's going on with safety in numbers. Beyond, you know, those issues, I think there's some other things, sort of human behavior stuff that I think deserves more attention, more study. I think this is fascinating. There's been a couple studies now shown when the cities that implement a bike share system, not only bicycle use goes up, but the bicycle number of injuries go down. Not the risk of it, I mean, the risk goes down, but the number of injuries go down. So this is stronger than safety numbers. Safety numbers says the number of injuries goes up, but the risk goes down. But we're seeing in these bike share cities, the actual total number of injuries go down and the risk goes down, which is great news, but there's other sort of pieces in here. You know, we're human again. You know, why are luxury vehicles overrepresented? You know, what's going on there? There's something going on. I see a question in the back.
Do you know if the same thing happens with like junk or line bikes? They're adopted into a city. Will the same thing happen? Or is it
I think so. The question is would be jump and
line bikes.
Line bikes. I think it's the same issue. I don't know what brand of bike share system we're looking at. I mean, this is New York City.
It's like city operated like bike share.
I don't know who the operator is. I assume that it's a contractor. I don't know. Not the city itself. I don't know the answer. Maybe someone in the room knows that answer.
Lyft operates the New York City bike share.
Okay, catch that. Lyft operates in New York City. But this has been shown. There's a study, look at five different cities that implemented bike share and 5 cities that didn't, and the total number of injuries went down in those 5 cities. And in New York City, the total number of injuries went down. London, the total number of injuries went down, and I think it's Philadelphia. There's a paper that showed total number of injuries went down. I saw another question.
Are the total number of injuries the absolute number of injuries, or
Yes.
are they normalized for the usage?
No, the absolute number of injuries. Yeah, so that's it's great news. That this is what we want to do, is reduce the number of injuries. So what's going on here? Why does a bike share system bring down the total injuries? The bike share system is more visible. Somehow does that become more acceptable? I think it needs to be dug into. I think this is an area for research.
Is it just 1 year data or multiple years data?
Multiple years of data.
I'm wondering, the large text mentions injuries and the small text mentions deaths, and I'd just like clarification.
Oh, okay, yeah, yeah, you're right. Yeah, good point. Yeah, so actually this paper, I should have said deaths declined. So that's my mistake. Yeah, these are all. Yeah, this is a reference to this paper. Yeah, I'm sorry. Actually, it's correct the way it stands. I'm my bad. Yeah, so injuries went down in the bike share cities. Deaths are disproportionate with striking vehicle, and this is London. And why are males so dominant in bicycle deaths? I'm a male. So I'm guilty. But what's going on? Something's going on that just isn't explained by the physics of the pool ball being hurled across the pool table. There's something else going on. So what do we do with this information? What to do when we know this information? I'm a firm believer we should make it easier for the motorists to see people walking and biking. I talked earlier that we can only process 3 things a second, just physiological. So that means that's an argument for bringing the speeds down. So you've got more time to actually see more things. So I think speed is huge, and we just need to bring the speeds down in America. I think marking crosswalks and bike lanes. I'd love to see more research on this. And just remind the motorists that there's a bike lane on the other side of the road. There may be bikes on this road. I put this picture of Abbey Road. This is what 1967. Someone in this room probably knows when the Abbey Road came out. That's Fab Four crossing this road there. In 1967, this sort of crosswalk was rare in America. That was called the Continental Style Crosswalk, but that was those. In America now, these are called high visibility crosswalks, but they're still not universal. We still use the traverse line for a lot of crosswalks. Why is that? Paint is cheap. It's the expensive part of marking crosswalks is getting the crew out there to put the paint down. Paint, it's budget dust. But then look, today you can go and look at a webcam of Abbey Road, and you can watch day and night. Watch people crossing Abbey Road, just like the Fab Four did. But look at what they've added since the days of 1967. So the center line and edge stripes, they start zigzagging as you get close to the intersection. So heads up, motorists, we got a crossing coming. They've added traverse lines to the longitudinal lines. So makes it a crosswalk maybe easier for the person walking. I don't know. Good question. And people that have been to Britain, they have these motion beacons where at night they slowly flash. Or it's not even a flash, it's more like a glow and glow. So as you're driving along, you see these things. They're pretty dim bulbs. They're not really like I used the wrong word saying flash, but it's just like a little subtle. So it just makes it easier for the fire away.
So I wonder, is there a limit to where if we're so focused on making designated crossing points really visible, does that backfire then when, if we make it so easy to know when there's a crossing point, then what happens when there is somebody not at a crossing point and you're used to having those visual cues? You know what I mean?
All right, yeah.
Is there some backfire? And another
Yeah.
thing I thought about is like a really egregious example of this kind of thing. I know there's some communities like in rural parts of Washington where in small towns on like state highways, they have a system where you have to pick up a flag on one side and hold it and like walk across with the flag and then put it down. Do you think that's good, or is that like putting too much burden on the pedestrian?
Okay, so the second question, I've seen the same situation in Lee Mining.
Yeah.
You know, they have flags, it's a big 5-lane road going through Lee Mining, you know, this small little tourist town. Why is that a 5-lane road going through? There's no center median, you know, center medians. If you really want to protect the person walking across the street, you'd think you'd want to do that in a tourist town, right? Because you're gonna, you know, someone's staying in a hotel on this side, they want to go to the restaurant on this side, you're gonna have people walking across. So, you know, why give them a flag? Why don't you put a median so you only have to cross, instead of crossing 5 lanes of traffic, why not just cross 1 lane of traffic? You know, I've been there in the wintertime, and in Lee Mining, they plow only 1 lane, and they pile the snow up in the center, so you have a big pile of snow in the center. You know, but does that really need to be a travel lane? You know, and you know, yeah, it's funny. I had a buddy that worked for Oregon DOT, and you know, he said all these small towns they wanted to have a 4-lane road in their town, so they were you know a big town, but then they complain about the speeding. You know, because you're on this 2-lane road and you're behind some car, and also there's 4 lanes. Oh, I can pass this guy. Well, the speeds go up. You know, so you know, I think you know people haven't really thought through these issues. I think you know, through Lee Mining or whatever town you're looking at, let's do it as an infrastructure issue, not a victim. We're not going to change the victim as much, and then it falls into the whole concept of victim blaming. You know, what's the old famous quote on victim blaming? It's a subtle process cloaked in kindness and concern. I always love that. And the first half was
Kind of if we design everything so that these crossing points are always visible, then are we creating more risk for people who cross at a place where there aren't these visible kind of interactions in the landscape?
Yeah, but why don't we have enough of these crossings that are good and protected everywhere so people aren't tempted to cross midway would be one answer. There are some questions like that. The city of Berkeley has bicycle boulevards that are all streets parallel to the major streets. And so maybe that's good for the people that use the bicycle boulevards, but the bicyclists on the major street, maybe they're at more risk, you know, so that becomes like yeah, you're getting at some interesting questions, and I don't think I have the answer.
I
Fire away.
just have an anecdotal experience to add to your first question. So I'm fresh from Las Vegas, and we have a really severe pedestrian death problem. And there was one road that I had to drive down every day. I think it was 6 lanes wide, and they know we have a serious pedestrian death problem on that road. So they put in this massive signage and lighting structure above the crosswalk because they thought that maybe drivers would pay attention, except that it was so grand and flashing all the time that it became normal. And there was, I mean, you'd think there was a woman walking across with 3 children, and you'd think that if they were ever going to pay attention, that would be the time, and all 4 of them ended up getting hit by a car because they had such a grand display of pedestrian crosswalk, but people got so used to it that it didn't mean anything anymore. They go through it normally, so.
Yeah, thanks. Yeah.
Sorry to bum everyone out.
No, this is real. This is what's happening.
Yeah. You know, this whole question of, you know, what safety numbers really is about number of injuries versus risk of injury. You know, that's really what this whole thing's about. The kind of we hear this sort of tension in the room too, is like, you know, which is the issue here. And you know, from an individual point of view, I'm worried about my risk of injury. You know, I'm going to walk across, you know, I sense the risk and I respond accordingly to the risk. And so like downtown Davis, I'm pretty comfortable. But in outskirts of suburban Sacramento, like I'm pretty cautious, and I'm prepared to run at some point. If I'm in Levining, it's very, I'm prepared to run if it comes to it. But one of these days, I'm not going to be able to do it. So what happens? I can't cross the street anymore, or I have to get in the car to cross the street. That's crazy. But so for the individual, we look at the risk of injury, and then from a public policy point of view, where should we spend money for making pedestrian safety better? And I argue this should be spent on where there's a large number of injuries. So statewide money needs to be focused in where there's a large risk, or where there's a high number per capita of injuries. So like San Francisco, Berkeley, that's where we need to spend state money where we get the most bang for the buck, with making pedestrians safer, reducing deaths. That's going to be money spent in San Francisco, Berkeley, places like that, where there's a high number of injuries, even though the risk might be low. So it's a little bit of a contradictory message. Yeah, you're safer in San Francisco, but let's spend safety money in a safe town. But far away.
I'm wondering, in terms of retrofits, that makes some sense, but in terms of new construction, I wonder if we should simply have a better standard for what we build.
I'm with you 100%. Yes, yeah. I think the way we build roads aren't good for people walking. So yes, or biking for that matter. I gave you a little startup spiel at the beginning of my background, and I recognize that talking about whether or not Pasadena is a risky or safe place to bicycle. It turns out I got sort of pulled into a early effort on the obesity crisis, and this is back in the late 90s. The California Centers for Disease Control and Prevention gave money to the state of California Department of Health Services, trying to get ahead of this obesity. Like in 1990, you could see it was starting to rise, and the California Department of Health Services put together a task force to try to encourage more. One of the issues was that we build communities that encourage more activity, and so I got to know the person who was in charge of that program, Ann Seeley, and somehow in just in a sidebar conversation after some meeting or something like that, we got to talking about this, and she explained there was a tension in the Department of Health Services. They're saying, yeah, we want more physical activity to make people healthier, but are we going to just set them up so we're going to have more injuries? And it turned out that her boss is in charge of both injury prevention and activity promotion, and so they were able to discuss that issue, internally, and they knew this was a tension they had to work on. And then, like I say, just in the sidebar conversation, I talked about, Pasadena actually has a high number of injuries, but it's a low risk. And I said, well, this relationship isn't linear. It's a curve. And basically said, if you could, find other data like that and publish a paper on this, that paper would be golden and it'd be well received. And so that's what I did. I found more data and wrote up the paper, and indeed it was well received, and it's something I'm very proud of having written. Should we encourage more physical activity if they're going to be injured? People are going to be injured. Well, two things. One, the risk goes down, but let's not forget this is the health benefits far exceed the risk. And what is the risk of more physical activity? Well, actually, air quality is a bigger health risk than injury. So let's get this injury in perspective. Movement is powerful. Movement is good for us, and and air quality. So air quality is the bigger issue of the two harms. And then keep in mind, both of these are caused by motor vehicle use. So really the question is, can we decrease motor vehicle use? This Lars Anderson wrote this paper as part of the Copenhagen Heart Study. But in Copenhagen, enough people bike to work that one of the questions they asked, trying to figure out what the risk factors are for heart attacks, was, how do you get to work? Do you bike, drive, take transit? And what they found in this is that biking to work was the healthiest way of getting to work. Driving to work was the least healthy way of getting to work. People who bike to work live longer than others. So, indeed, physical activity is healthy, it's good for you, and driving is harmful to health. Another question comes up. I think the people who were here last week, here heard Neil Aslav talk about, how do we address climate change, and the power of getting more, the health benefits of getting more walking and biking to replace car trips. Here, this is ongoing right now. This is, St. Mark's Square in Venice is underwater. I think this is, it's like the sixth highest it's ever been, and the tourists are, walking through the water, and they're creating high water marks in the village. This is awful, And then, this is Miami, which blows me away. This is what they call blue sky flooding. So it's not raining and it's flooding, So I'm amazed that people would still buy real estate there. I don't understand that at all. But, so should we encourage more walking and biking, to address climate? Yes. So that would be part of the solution. There's another thing that just sort of came up in the news recently, and that's National Transportation Safety Board recommended helmet laws. And basically said all states should invoke a mandatory helmet law. And that came not from the professional staff, that came from the political board members. But what's happening is the number of deaths of pedestrians and bicyclists are increasing, which is really kind of a shock, because better medical care means the numbers should be going down all the time, everything else being equal. So something else is going on. Deaths to people inside cars are going down, but that's of course be expected because of just better medical care. But deaths outside are going up, so something bad is happening.
I was a claims adjuster for 20 years, and I came to see that the state law that requires people under 18, I believe it is, to wear helmets in California is a result of insurance companies lobbying for the law. And what it allows insurance companies to do is when a driver collides with a child and injures them, and they're not wearing a helmet, then the parent is quite responsible for a large proportion of injuries if they're to the head.
Right.
And those are like the most significant. So,
right. Yeah.
And also in the B today, there was mention of a $10 million judgment in a bicycle crash on the American River Bike Trail in Folsom. Interesting article.
Well, getting back to the first point, which I think is key, is there's a legal term for it which skips my mind right now, but in the seatbelt law, California seatbelt law, there's a specific clause in there saying the fact that the driver is not wearing a seatbelt will not affect the judgment. But there's no such clause in the bicycle helmet law, which I think is, we're talking about children here, so I think it's a really unethical situation. But okay, so but I wanted to make the point here. This here's the National Transportation Safety Board just this month is saying, yeah, the state should invoke the helmet law. But you can see here, there's a little controversy. So I want to dive into the controversy a little bit. I don't want to spend too much time. But so if you look at bicyclists who show up in the emergency room, those who had helmets on had significantly less head injuries. The early studies showed like 85% fewer head injuries, and that gets quoted a lot. More recent studies, it's more like 50%. So that's right off the bat, there's a curiosity, why is the benefit decreasing? So there's something going on there that we don't quite understand. But then on the flip side, here's this, New York Times story, basically saying, I'll zoom in on the text here. So despite a large increase in helmet use, we didn't see any benefits in reducing, head injuries. Indeed, bicycle numbers went down, so the risk of a head injury went up by 50%, even though helmet use went up. So at the you're doing studies at the emergency room, you see a great benefit, but at the population, we don't see a benefit. So there's some controversy there. I think what's going on is the cyclists that show up in the emergency room aren't typical cyclists. They're the high-risk cyclists, which are going to be the bicycle racers. They're going to be the mountain bikers. They're going to be the pack riders. The other high risk, those all three all wear helmets. And the other high risk factor for injury on a bicycle is being seriously intoxicated. These are hardcore drinkers who have blood alcohol rates like 0.24. I mean, one study, the average of the non-responsive patients, the blood alcohol content was 0.24, which is 3 times the legal limit. You or I don't think could withstand that much alcohol in their system. If you drink consistently, you learn to tolerate that much alcohol. I think most people in this room would have difficulty walking at the legal limit. At 3 times the legal limit, I think you might be dead. You know, so yeah, every now and then you hear about a fraternity where they had hazing and too much drinking. They kill someone because the body's not used to that much alcohol.
I'm wondering if fatalities are removed from this, and so the people who are dead from head injuries aren't counted.
Well, it's a curiosity. Even if you look at some of the work that's been done on that, you'd think that a helmet as a safety device would be very effective against a mild injury. So, I mean, this is what 3/4 inch of styrofoam, or whatever. So you'd think it'd be very effective against the minor injuries, right? And then as the injury severity increases, it'd be less and less beneficial. But that's not what the research shows. It shows that indeed they are very beneficial at the minor injuries. And that's the ER. Typically, 90% of the injuries at an ER are minor injuries, because major injuries are thankfully rare. So this research shows that there's strong benefit at against minor injuries. Then actually the research shows there's no real benefit at more major injuries like hospitalizations. But then on the flip side, we have a strong benefit against fatalities. So you have this U-shaped benefit, which is really tough to explain thinking about physics. And I think that's more of a self-selection. I think it's a reflection of who wears helmets, who's likely to be injured. They're getting back to who the 3 at-risk populations are. So those racers, mountain bikers, and pack riders. Those injuries are typically not involving a car, but the intoxicated, the extremely intoxicated people, those do involve a car. So, I think that's what's going on there. I think there's a big self-selection thing occurring. But there's a safety in numbers, and the reason I bring this up is not because of that, but to say there's a safety in numbers thing. Getting back to my curve, there's more bicycling this way, the risk goes down. But one of the problems is that with a mandatory helmet law, you're going to lose some of the population. Some of the people aren't going to bike anymore. They're just not. These are going to be the low-risk bicyclists. This is the person going to the grocery store to get, a pint of milk. This is the student at UC Davis trying to go from class to class. That's a real low-risk type of bicycling. And so you lose the low-risk biking, but the high-risk guys, the racers, the mountain bikers, the pack riders, they're going to continue to bike, and the intoxicated people, they're going to continue. So, you're going to lose the low-risk guys. So I think that creates a huge sort of, is it even ethical to do something that might increase risk, decrease the number of cyclists and increase risk? I think it's a real problem. Anyway, sort of conclude here. I think you guys are all in a great position. I think we're in interesting times right now. I see like 2 different models for the future. One model is the autonomous vehicle. Wouldn't it be great to have your own chauffeur on a stormy, rainy, blustery day, pick you up in this warm Chrysler LeBaron Imperial 1959, and take you where you want to go? It's just, you don't even have to deal with a human. You just tell the car, home, James. So that's one model of the future. But the movie Wall-E, made a whole lot of fun of that sort of future. What's going to happen when people get chauffeured everywhere, and you can watch a screen while you're being chauffeured, and you can drink your sugary beverage. it's not a very healthy, so we got a situation here which is inequitable, it's high resource consumption, it's high carbon emissions, unhealthy. So we got sort of like this future which is being pushed in this world. And then we got this other view, which is the Amsterdam or the Netherlands, where it's healthy, equitable, low resource, low carbon. We have two different visions, and so I think it's interesting times which way we're going to go. And Neil's mass lab last week was sort of pushing this future for health and carbon emissions. This cartoon appeared in the magazine New Scientist. This is last week, and so I just had to put it up here. So I basically encourage you to ask me questions and not give me the blank look. So.
Just a comment. Last week, news shows that in California, the average walking and biking time for the commuting trip is like 2.7 minutes. So
Okay.
there's not much you can go further. You can go a little further. So I think the train has to go. Yeah. It's already very, very low.
Thinking back to the slide where you make recommendations to fund active transportation infrastructure in already well populated in terms of active transit users areas. I struggle with that recommendation from using an equity perspective. So if we're adding more money to places like Berkeley, where it's like obviously we want to put money there, but there's I think a divide right now in the active transportation conversation around how to allocate funding, and equity proponents are saying, if we're going to use active transportation to address climate change, let's look at communities that have no access to even the option. So rural communities, for example, where people are driving so much and have very high risk commutes if they're going to walk or bike, and low access to sidewalks, or have spent the last 30 years trying to get a crosswalk, thinking about unincorporated communities in California, or access to water. So I feel like when we make that push, we're perhaps continuing to underserve already underserved communities.
Yeah, I think that you're making a valid point.
Yeah.
And I was thinking just in terms of number of injuries and risk of injuries. Life isn't that simple.
I think it's a dangerous policy implication.
And, so going back to Lee-Vining, that here we have this community that's 300, 500 people, so the tax base is probably very low. And you have this major state highway that was 395 going through it. That's a five lanes and wide. And, should the state be working to undo some of the damage? And they throw in the equity issues, poor, low income, low resource community. You raise a good point. And you can't be blind to that.
In terms of state funds, the California Transportation Commission chose to not provide SB1 money for bicycle and pedestrian projects because they say that those projects are being funded separately, which is through competitive grants. So my opinion is that Caltrans should improve the pedestrian and bicycle facilities every time their boots hit the ground.
But it's also how much money is spent per capita on transportation in California. And I just recently saw a number that I can't pull it off the top of my head, but it's thousands of dollars. Well, I think it's like $600 per capita spent in the U.S. on transportation. And I think in California we spend somewhere like $1 per capita on walk-bike infrastructure. So there's a again, getting back to the equity question, is it fair that all the money is spent, moving vehicles faster and not getting people across our way?
I would just wonder how you feel about if autonomous vehicles start to become more common. Is there some hope that they are not going to have the same issues in human perception and that autonomous vehicles might be better towards cyclists? Or do you think there actually might be more room for autonomous vehicles to be looking for other cars, but maybe not looking for pedestrians and cyclists?
Well, we saw that in was it Phoenix, where was it Uber? I forget which one. Is it an autonomous vehicle? And there was a woman walking her bicycle across the street mid-block, and there's plenty of time for the vehicle to react, but yet this autonomous vehicle did react. I guess they had like a 1.5 seconds to respond, and there was a 1 second delay before the alarm went off to alert the guy behind the wheel. It's like just, so it just didn't recognize it. I think we're going to see the same problems. It's, we got, getting back with human perception, we got something small, inconspicuous, moving slow. That's just going to be hard for a computer to pick up too. I'm far from an expert on autonomous vehicle, and I bet there's someone in this room that knows more than I do. But I think just from a processing point of view, it's going to be difficult. You can have, or would it lead to in a future with autonomous vehicles even be more so that, crossings only at the intersections, that sort of thing. I mean, this is what happened, back in the early days of the automobile, back in the days of, back before the automobile, there's a law was well established, a due care law that basically says, hey, if you're the person that creates the danger is responsible for the damages created by that device. And so you had a horse-drawn wagon, and the horses get startled and they bolt and they run over a child, say, with the wagon and kill this child. Well, then it's a civil action. You basically sue the person that owned the wagon, and you collect damages. Then in the 1920s, we developed the whole right-of-way rules, which is basically what's taught in driver's education program, that says, hey, the slower object speeds yields to the higher speed object. So the high-speed road goes, and the slow-speed road stops. So there's a conflict that was created in the 1920s that I think has not been resolved. You hear stories about in the Netherlands and Belgium where they just run by the due care rule. They don't have the right-of-way rules, and so so it's assumed that the motorist is at fault if they hit a person walking or bicycling, and then it becomes the responsibility of the motorist to prove that no, the person walking and bicycling did something dangerous. Speak on the microphone's up here.
I'm not aware of it, but what do you think maybe might happen if you diminish traffic flow by either road diets or like congestion pricing? Like, because you'd assume that in maybe the latter, like they did in London, maybe traffic speeds would increase, and maybe there'd be more like pedestrian strikes or fatalities or something.
Yeah, so the question is what happens if you had less traffic volume, and that would be the London congestion charge. And I think some of the early results, maybe someone in this room knows better, I think the early results, actually the injuries went down. It also encouraged a lot of people to bicycle and use transit. So there's less danger in the world, there's less cars within the town. But you're right, because there's less congestion, the speeds are higher. But I'm not totally up to speed on, but I think it's a great subject, and I think that's been investigated. I think Transport for London has research on that. Our way.
So I have a question going back to Las Vegas. It's a very large city. They have almost no bikers or pedestrians except in low-income areas, and normally those people are bikers or pedestrians because they don't own a vehicle. What would you suggest for a city like that to retroactively try to help people be active transiters rather than driving everywhere, especially since it's a very sprawled city.
Yeah, it's a tough climate too, right?
Yeah, it's very hot.
Yeah. Yeah, I think it's difficult. I think that's the bottom line. I think that's it's the same thing we've seen elsewhere, though. Could we, it wishes for horses. It has lots of money in Vegas. Could we put in protected bike lanes in Vegas? We have these big wide roads. Why can't we take some of that space, like Mace Boulevard, put in a protected bike lane? Can we do things like plant trees so we get some shade? Is that water's tight in Vegas? I know, but could we do that to make it a little bit more attractive? It turns out that attractive situations encourage people to walk and bike. People they'll go out of their way. They'll go find a more attractive route even if it means more time. So time is less important than just being physically appealing.
So my intuition would be when you're starting to put in this type of infrastructure, you start in the middle of the city or in the middle of the area where these people are biking and walking out of necessity, and then you maybe start to build it outward and see if you can capture people further and further out to use it. Do you agree? Or
I think that makes sense. I mean, there was a paper that showed that the most risky place for children walking to school is close to the school physically, which kind of makes sense. So they're coming in from all directions, and so where are the injuries going to occur? Well, they're going to be close to the school. So maybe start at the center of this, start at the school and then work your way outward. So I think that you're basically doing the same thing at the citywide level. Where's the attractor? That's the downtown where the jobs are. I assume the jobs are on the strip, and then work out from there. And then getting back to the question earlier, where should we have these attractive but relatively expensive things? Should we build these to serve the low-income neighborhoods, or we're going to do that to the high-income neighborhoods? So you get this equity issue that kicks in.
Following up on the equity issue, our current systematic data collection in California that goes into splitters is only on the public roads, and tends to undercount pedestrian and bicyclist injuries, especially if a motor vehicle is not involved. And although we fund off-road paths with transportation dollars, that data does not go into splitters. And so I'm wondering about the equity of not counting, and how can we make good judgments about safe infrastructure.
Yeah, I'm going to repeat the question because I'm not sure the microphones can pick up from the edge of the room. The question kind of is, there's a statewide database called SWITTERS that takes in, all the police departments report into that, and the California Highway Patrol consolidates that and prepares an annual report. It's called SWITTERS. And by definition, the SWITTERS database is motor vehicle injuries. And so yes, indeed, it doesn't count, falls, walking falls. It doesn't count bicycle falls. And there's been some research on that that shows that indeed, because pedestrian falls aren't recorded officially in transportation databases, they tend to get badly undercounted. And so it looks like walking is actually maybe a little bit more riskier than we thought, because a severe undercounting of just falls, which are an infrastructure issue, sidewalks that have a irregularity into it or whatever. And then likewise, bicycle falls get discounted. I think that's an issue. The CDC, it's almost by definition, or it is by definition, how the data, pedestrian injury involves a motor vehicle, but a fall doesn't. But the falls could have occurred during transportation. Yes, falls occur because you fall off a ladder, but indeed you also fall when you're walking to the grocery store. That doesn't get counted as a transportation incident, and that leads to a poor understanding of the risk, and then also a poor allocation of the money. Because we don't spend the transportation dollars fixing sidewalks. That's a huge issue. Yeah.
Or design standards where they put obstacle posts on bike paths, and what is the relative risk?
Right. Yeah. It's a reference there to state standards for bike paths. We see these in Davis. There's poles in the center of the bike paths, and that's to keep motor vehicles. But I know at least there's one bicycle rider, actually Chico, who hit a pole while riding. He snapped his neck. He was wearing a helmet, which may have aggravated the neck injury. Good question. And he spent the next year in a wheelchair, and then he died. So here's a post stuck in the middle of a bike path that severely injured and arguably killed this man. So which is do we need those poles? Is that the best way to handle it?
Any other questions?
So, increasingly, most of these bike share programs use electric assist. So there has benefits of actual bicycling in a bike share program. Won't be the same as you get an equivalent amount of bicycling on the system right now. So are there studies already which quantify like the decreased health benefit? And what are some thoughts and how cities are pursuing funding this kind of programs? Is health still an indicator that's the thought of being promoted when you're funding bike share programs?
Yeah, I'm going to repeat the question because I don't see any microphones on your side of the room. The question is, it seems like the bike share systems are moving towards electrified bicycles, electric assist bicycles. And what does that mean for the health benefits of bike share programs? Well, I recently saw, actually I think yesterday, the day before, there was a study that showed that e-bike riders, and I'm sorry, I'm going to butcher the data, but e-bike, non-bike riders have basically the same health benefits. They get their heart rate up, but that was mountain biking. It's curious enough, the mountain bikers thought they were getting a lot of assist, but they were actually getting a lot of physical activity. They had heart rate monitors on them. And then just purely anecdotal, I have a buddy who just got through buying an electric bike, and we just talked earlier today that he rode his bike from Manhattan Beach to downtown Los Angeles, and he was riding with a friend of his who was going to work, and my friend was retired, and so he was just going to the pantry to have breakfast. But they rode together, and my friend said, "Oh, he had his heart rate monitor on," and he was surprised. It's brand new, electric bike, and he's got the electric bike on the lowest possible boost, to keep, to be even with his friend who was on a regular bike. But he found his heart rate was basically where it was on his regular bike. So I don't have the answer, but it looks like e-bikes still give you a good health benefit, but maybe not as much, but maybe he just pushes a little harder. Maybe the mountain bikers in the study I'm thinking about are just going up the hill a little harder, even the machines giving him the boost. My friend was quite happy. He was really happy with this new bike. So,
yeah, there are like 3 or 4 studies about this now.
Okay.
And they're pretty much all say the same thing. E-bikes give a good amount of physical activity. I think it's also to the point of people with an e-bike are willing to ride further. So you get the benefits because you're going a little further. You're reaching destinations you might not have gone on a regular bike too.
Yeah, thanks, Tom. Yeah. Let me do a new guy. Sorry.
In a tourist place like Hawaii, where the weather is like really nice, or like Las Vegas. It's like on a daily basis, one of the biggest concern in Hawaii is drunk driving and speeding. That's the the most number of crashes happening in drunk driving. So if you have a policy that you did mention that I was thinking, such as outreach and education, would that help in reducing the pedestrian accidents or crashes?
Yeah.
Or helping the numbers for people walking on the street, whether it's really nice?
Yeah, to repeat the question, does education have a benefit? And I think that's a very
outreach. Yeah, outreach, outreach to the community, saying the drunk driving is really bad.
Yeah, I think I'm not an expert on the evidence, but I know there is evidence that shows teaching children pedestrian safety. You can see changes in their behavior, but you don't actually see. There's no evidence that there's change in the injury rate. So maybe there's a benefit, but maybe it's small. But of course, education is just another form of advertisement. So advertisement works because otherwise the manufacturers wouldn't advertise. But maybe they're advertising different things. I don't know. That's just not my little niche. So I don't have a good answer for you. I'm sorry. Let's not make that the last question, though. But maybe it will be.
Like in developing countries, used to be the streets are sea of bikes, right? People bike, and then as the economy develops, there's sea of cars, and they all clog. And they watch the Hollywood movies, and nobody racing bikes, and they're all racing cars. So you think that what's the most effective way of reversing that culture, that tendency that almost like built into the system to have people more walking and biking?
Yeah, but I look at can we get encouragement? I get it. You look back. There's just a recent thing with some country just was talking about banning rickshaws because they thought they looked backwards. But here's a low cost, low carbon form of transportation that's a source of income for many of these operators. They're talking about banning them because it looks backwards, and they want to go towards our system. But you look at places like the Netherlands. In the Netherlands, they're proud to say that in the 1970s they were doing what the Americans were doing. They were tearing down buildings, widening roads, creating parking lots, and there's a big pushback. And the Dutch people basically said, we don't like all these injuries. We want to see more human stuff, and they made it happen. And so, can we do that? Can that be our future model? Can this be the future model? So here's Copenhagen. Obviously a wealthy city in the Netherlands. The Netherlands like to say, hey, we have Copenhagen is great, but we have 200 Copenhagens in our country. They can do it. So can we do it here? I get it. There's a status thing to having a motor vehicle and being able to, on a cold, blustery day, to in a warm car. That's delightful. But can't I think there's a tension to be determined.
Okay, with that, we'll want to thank Peter again.